I'm Ali, I'm one of the Clinical Teaching Fellows at York and Scarborough Hospitals. I've worked here for a little bit under a year and the role's been a great opportunity for me to work on my teaching skills. What room are we in today?
Teacher room 4.
Fab, thank you.
You're welcome.
My name's Munib. I'm working as a Clinical Teaching Fellow at York Hospital and I've been working here for the past 7 to 8 months.
My name's Jess Hebron and I'm a Clinical Teaching Fellow here at Hull York Medical School. Medicine is brilliant and being able to pass it on to other people, the excitement is the best thing.
We usually require about 10 to 12 teaching fellows every year, and the reason we need so many is because we have about 400 students across the years at any one point having contact with teaching fellows. They will work mostly at York Hospital but also at Scarborough Hospital for periods.
Teaching fellows are absolutely crucial to how we work and how we can deliver the medical education that we want.
I spend 4 days a week teaching. The majority of that is bedside teaching.
Had some pain here.
Those will be sessions with 2 to 4 students where you do a little bit of teaching in the classroom, often covering the topic that you're going to discuss in bedside teaching. Then up to an hour or so with patients on the wards, teaching histories and examinations.
Alongside that we do some sort of simulated activities, so that might be virtual reality, simulation in the sim suite.
A simulation teaching session would involve particularly a management of an acutely unwell patient. We get to have a mannequin that acts as our patient. That gets the students to work in a high stress environment without actually looking after a real patient.
At the beginning of each block we tend to do a couple of lecture classroom style teachings, but I would say most weeks we wouldn't do a lot of classroom teaching other than kind of prepping the students before the clinical sessions.
We generally tend to work in groups of 3 to 4 students, and it works well in small groups because we get to know the students.
The relationship with students, I think I see it as a bit of a privilege really. They're at such a pivotal point in their sort of careers, they're developing as clinicians. It's just lovely to see.
One of the things that you get the opportunity to do here as a teaching fellow is a clinical day, and not all teaching fellow posts include this as part of their jobs.
I chose to go to accident and emergency. It's exciting, a brilliant place to be as a junior doctor, it really is.
I spend 1 day a week in orthopaedic surgery where because I'm supernumerary I don't have to go on the on-call rota. However, I do have the option of going to theatre or going to fracture clinics. It's worked really well over the past 7 to 8 months where I have improved significantly in my surgical skills as well as looking after patients.
So what sort of person are we looking for? We're looking for somebody who is self-motivated, who's enthusiastic, organised, flexible, but above all else we're looking for somebody who's got a passion for teaching.
We've taken great efforts to make sure that our teaching fellows are really supported by the senior faculty here. We ensure that the teaching fellows have mentorship, they receive annual appraisals, we ensure we meet with them periodically to see how they are.
When I started this role I only had minimal teaching experience as a medical student, but I felt that I was really well supported in that role. The medical school team was excellent in organising our induction and giving us training.
I think I'm very biased because I grew up around here, but I love this area. It's beautiful, you've got a bit of something for everyone. Everyone tends to be very friendly. Some great food as well. It's a great place and generally people who move here love it and they often stay.
You can travel to the countryside, North Yorkshire Moors, you've got the Dales. Scarborough's also a really beautiful little town. I worked there in F1, so I kind of knew the hospital and it was nice to go back to that friendly environment.
The other advantage of the role, the fact that the job is Monday to Friday, 9 to 5.
It's a hugely enjoyable year. It's an excellent opportunity to boost your CV in a huge number of areas. We encourage our teaching fellows to do a PG Cert in medical education, if that's something they'd like to do, and we can provide financial help with that. You'll learn loads of transferable skills, and I think really it's summarised best by the number of trainees that we have who go on to get the speciality trainee jobs that they want.